Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video that I've named the Impossible Earwax Removal. So of course you'd be interested to know why I chose that title for this video, and it's because this patient, believe it or not, has visited the high street, which I won't name, to attempt to have the earwax removed from both ears on 3 separate occasions in the last month, and that's totaling 1.5 hours. Each appointment is half an hour long, and eventually the specialist at the high street advised the patient to see myself. So the patient came in and they said it's an impossible case because obviously they've had 3 failed attempts. The most recent one was actually in the morning of the day they came to visit me. After the appointment that they had at the high street, they experienced severe ear pain and tenderness. They took some ibuprofen before coming. And we're just starting off in the left ear. And this wax, I used microsuction initially, and it was rock solid. It was the core of it anyway was rock solid. Around the edge, it was a bit softer, and that's because the patient had been using drops, a lot of drops for the last month. So I've used an ear hook just to dislodge it. I thought, let me use some forceps to get a bit of purchase. But although the core is quite solid, the outside, the perimeter of this plug of wax and skin is quite soft. So it was difficult to get purchase with forceps. So I'm just going to go back in with the hook. I'm just inserting it at the base of the ear canal and then rotating the hook clockwise to get some purchase. And I'm spinning it, and it's at the moment dissecting this plug, but in a moment it will come out in a huge plug. So I'm just using the microsuction just to, again, lift this off the canal wall. Sometimes we use instrumentations in tandem. Now, I asked the patient when they had their procedure performed what technique was being used, and they said just microsuction, no other instrumentation was used. And it's quite a common theme actually in the UK. A lot of companies, a lot of specialists are just using microsuction, and we need to be a competent clinical ear care specialist. You need to be able to use all instrumentation. It's vital. And this is a clear example. So I just inserted the hook, the roof of the ear canal, rotated it clockwise. So I went to the top and then rotated it to the right. I managed to get right behind the plug of it was actually really hard wax and skin. So patients within 2.5 minutes managed to clear the patient's left ear. They've got a tympanosclerotic eardrum, so they had many infections as a child. You can see the eardrum's intact, but around the perimeter you get that white scar tissue, and we call that tympanosclerosis. It's just calcification, so calcium deposits developing on the eardrum in response to some sort of trauma, whether it be barotrauma, so pressure change, acoustic trauma, so loud sounds, physical trauma, so injury to the ear, acoustic trauma, so loud sounds, or in response to chronic ear infections or perforations, the eardrum can heal and it can develop scar tissue. So this is the right side. Now there is elements, again, I'm seeing a lot of these cases at the moment, keratosis obturans here as well. So there's a skin plug quite medial in the bony part of the ear. So I just used a bit of microsuction just to elevate it off the canal wall. I thought I'd use the forceps to see if I can get some grip, but there wasn't enough grip. So I've gone back to the hook, and I'm just going to go to the roof of the ear canal. I'm going to gently glide it in. We've got to be careful because we're on the bony part of the ear, and a huge plug came out. I thought that was it, but to my shock and horror, really, I went back in and there's another plug to remove, and the second plug is actually bigger than the one I just removed. So it's an incredible amount of wax and skin this patient has in their right ear. So just gone back in with the suction probe, just thought if I can gently tease this out, because we are on the bony part of the ear canal. Whenever we're on the bony part of the ear canal, my preferred choice of instrumentation is suction, because with suction, there's less of a need to veer closely to the bony part of the ear canal and make contact. With a hook, sometimes, and a Jobson horn, you're in close proximity to the bony part of the ear canal. But this is lodged. You can see I'm trying to rotate this plug of wax and skin and lift it upwards, but it is lodged. So I'm going to go back in with the hook. There's a bit of a gap at the top of the ear canal. You'll see me in a moment. Sorry, I'm going to go back in with the hook in a moment to hook this plug out. But yeah, just with the suction probe, it is lodged. It's like a boulder, this last piece. It really is a substantial piece. And I'm just wriggling away. I'm not going to put any more drops in. The patient's been using drops for over a month now. So any softening's been done. So fortunately, there's a bit of a gap at the top. You can see I'm going to delicately insert the ear hook. I've got the angle mirroring the angle, the opening, and I'm just going to lock it in place and slowly come out. I'm going to be careful that I don't over embed the hook into the plug of wax so it doesn't scrape the bottom of the ear canal. And if you keep watching, you're going to see some really good still images of all the content. So the ear canal's clear, symptoms are alleviate. There's some dead skin. This is on the anterior medial gland wall on the right hand side of the ear canal, the front part in the case of a right ear, and it's quite medial towards the eardrum. So I'm just trying to delicately peel the skin off. We could leave it, really. It's not going to cause the patient any symptoms, but it was comfortable enough for me to remove. I'm just going to use a fine end suction probe just to mop up the base of the ear canal. And you can see the patient's got some tympanosclerosis scar tissue, but this is only in the back part of the eardrum, so posteriorly and inferiorly near the bottom. Patient was over the moon, could hear significantly better. They were so pleased. As I said, they thought it was mission impossible. And so that's within 6.5 minutes, really. Both ears done. There's some really good still images of the plugs of wax. And I've just weighed it, so it's just under 1 gram, so it's quite a significant haul. Hope you enjoyed that video, guys. Take care. I've got some really good videos coming up, so do stay tuned. Speak to you all soon. Bye.